There are estimated to be about 400 tribes in the Amazon. Back in October, Brazil's Indians were nearly 5 times as likely to catch the virus. Since then, infection rates have soared. Infections have long been one of the most common health issues for indigenous people. Michael Gervin is an anthropologist from the University of California who has worked in Brazil's Amazonian neighbour, Bolivia, with their native populations.
Certainly, respiratory infections are a major source of morbidity and mortality. In fact, half of deaths are due to infection.
Gervin's main work has been with the Chimani tribe, which has actually had lower than expected mortality rates, which he suggests might be due to the resilience they demonstrate in their way of life.
There is a tradition that when infection hits, that sometimes people do scatter. If they have to retreat into the forest, there's actually strength because they have an ability to get resources from the environment.
Many of the tribes in Brazil, particularly those who interact more with the outside world, have seen much higher death rates. The Yaonomi Reserve, frequently invaded by miners, saw 10 native children die in January. Studies have also suggested that Bolsonaro is using the virus to attack Indians so that he can further invade the forest. Thomas Pizer from indigenous support charity Aqua Verde says that the natives are an essential part to holding back Bolsonaro and climate change.
Because they're the guardians of the Amazon forest. But they're the ones who really try to defend the forest, their land, because without forest, they can't survive.
The Amazon rainforest absorbs 2.2 billion tons of carbon dioxide a year. So if climate change is to slow, then the indigenous populations must be protected from the major threat that is coronavirus. Rhodri Andrews, Invicta News.